I think for me, it's really about being active in your different fields. So for me, public health and being on social media was great because I didn't need to be in the country for people to see that I was being active. I could be active on social media, which is how that first supervisor found out about me. So it was really about making sure I was making ongoing contributions and commenting, I guess, on public health issues on social media, as well as making a really good LinkedIn profile so that if anyone could look up me, they could see all the stuff I was doing, even if they could physically meet me. So I think those two things are really important for me. I need to get new headshots again, I think.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 75. Hi everyone, Omari Richards here. Thank you all so much for joining me. Be sure to follow me on Instagram at the PH Millennial. Subscribe to this podcast, leave a review if you haven't as yet. Leave a like if you're watching this on YouTube. Share with a friend. It helps get it out to more people. And if you want to support more than that, you can just continue to share this, share to more people. And you can go to buymeacoffee.com/PH Millennial and support there. But I really enjoyed this interview with this person who's very global. I chatted with her a few months back and we reconnected here and we get to share a lot more of her story. And I think just her story and how international and global she is and all the work and the thing that she has done being in Japan and then working in Australia and the US and her experiences all over. I think it's amazing, and it goes to show you that if you really want to get those types of remote positions, they're out there. You just really have to look in your network and gain those skills that you're able to apply to those different positions and show that you're able to do those roles, as well as keeping those references in your back pocket. But I'm not going to talk for much longer. I really enjoyed this episode, and I hope you do too. Today, we have a public health professional who's driven towards research in sexual health and social justice that empowers communities using evidence-based research. She has a bachelor's degree in psychology, Spanish, and Latin American studies from the University of Melbourne. She went to the George Washington University as a semester exchange student, and she went on to get her Master of Public Health at the University of Queensland. She currently works as a policy project officer at Mary Stopes, Australia, while living in Japan. We have Brenna Bernardino, MPH. Welcome to the show.
Thank you for having me.
Yeah, truly my pleasure. I'm glad that we can reconnect and have more conversation.
Yeah, I think we chatted maybe in February was the last time we spoke, and I always said I would come back and chat with you, but of course here we are almost October, so it's interesting how busy we all get, hey?
Yeah. I feel like that's just life, but it is funny because I think you came to one of my public health happy hours and it was just you and I, and we kind of having a conversation kind of like this. So I'm glad that we can reconnect, just you and I again, and talk more about your public health story. And especially I feel like you have a fascinating story, and I'm glad that you hopped on my happy hour to chat with me because I appreciate that a lot.
Yeah, no worries.
Yeah. So how are you, and how have you been coping during this time?
I'm doing well. I think I know what I need to do if, things aren't going well, which is usually make sure I'm exercising, make sure I'm socializing. That's kind of been ingrained in me, I think, in many of us in public health, as we know kind of what to do to support ourselves. So I think I'm doing okay. And, I think it's one of those things where COVID seems to be an ongoing thing. So it's definitely something where I'm not having the perspective of when will this end, more so how will we adjust? Yeah.
Yeah, and I feel like that is what it is coming to. It's like just a new type of way of living, at least for a prolonged while. I'm gonna guess, and it's gonna change a lot of how we just do things in life. It's because it has changed a lot of how we have done things, and it's also allowed me the opportunity to meet people like you, which is awesome. But I do hope that we get more people vaccinated and we get over this COVID-19 sometime soon.
Mm-hmm.
So tell me, how do you identify, and then tell us a little about your personal background?
Yeah, sure. So I use pronouns she, her. My mum's side of the family is from Timor-Leste and Portugal. And Timor-Leste is a small country right next to Indonesia. And on my dad's side is from Bardu Island in the Torres Strait, which is one of the two main Indigenous groups in Australia. And I've grown up mostly in Australia, but I've also lived in the United States, in Miami, Hawaii, and Arizona. And I'm also now living in Japan. And I'm a Gemini. I'm a Slytherin.
You're Slytherin.
That's a dangerous combination. And if you follow Divergent, I'm a Candor. So I tell the truth. I'm two-faced and I'm a bit malicious. I guess that's what you would get from all of those different groups. But obviously that's not entirely representative of who we really are. So, I'm in book clubs. I do karate for fun. And that's a bit about me.
Yeah, that is awesome. Firstly, how did your parents meet, if you don't mind me asking?
So I don't know. And I say that because I actually grew up with my mum most of my life. So she was single mum, but also my mum's mum, my grandma, I grew up with her a lot too. And so I actually call her mãe, which means mum in Portuguese. So we're actually that close that I don't call her grandma. But my mum did marry an American when I was 11, and that's how I ended up living in the United States for some time.
Okay, well, thank you for that. And then what belt in karate are you?
I am a yellow belt with one black stripe, which means I have only just started and have taken one karate test. But my next testing is next month, actually. So then I will get a second stripe. And for me, karate is an ongoing thing. You know, they say when you become a black belt, you essentially become a white belt again because you're having to start from the beginning of something new. So I look forward to continuing in it as much as possible.
Yeah, that's awesome. And good luck in your exam next month.
Thank you.
Yeah, you're most welcome. Next time you talk, you'll probably be a black belt.
But... Oh no! I'll probably only have another stripe, and that's about it.
Awesome. And then you're definitely a very global citizen. What has been your favorite place to live so far?
I mean, I feel like many people go to Hawaii as a visitor, as a tourist. And so for me to live there, I would say that was definitely one of my favorite places to live as a teenager. You'd go to school and you would see the beach from the high school, and we would just be, going to the beach every weekend. The weather was great. I wish life could be like that all the time. I didn't take up surfing though. I took up skateboarding or longboarding, I suppose. So I think that was definitely my favorite place, just because it was so beautiful. The people were lovely, and it was just a laid back environment that was really nice as well.
Okay, that's awesome. Sorry that you didn't get into surfing though, but it happens. And Hawaii is definitely the place that I was planning to go, but then the pandemic happened, and I'll probably plan to go some other time. But anyway, let's get back to public health story. What does public health mean to you?
Yeah, so I think public health before the pandemic was something that a lot of people didn't really understand. I know for me, when I was in college or university and I would get into my Uber, they would always ask me, oh, you're a student, what are you studying? And I would say, oh, public health. And they would say, oh, so you're a doctor? And I would have to say, no. Doctors essentially treat the problems, whereas public health professionals try to prevent the problems. So to me, it's really about prevention, and it's about being holistic, and it's about looking at some of the root causes and the structural issues that we all kind of face now, but also, it also is important for even when we're in the womb, as we get older. It's something that's really important across the lifespan. As I've noted, by going to the dentist and finding out I had a lot of cavities and really flossing every night now, I have to practice what I preach. So
awesome. I feel like I've also been trying to build in that flossing habit into my lifestyle. Definitely something that it is great for you, and but I don't know why it's not like a norm for the most part. I would think. But anyway, so you grew up in Australia?
Yes.
Where in Australia did you grow up?
I grew up in Brisbane, so it's in the same state as the Great Barrier Reef, so very warm, very sunny. But I did go to do university down south in Melbourne, where it's a little bit colder, but it's more of a urban environment. Yeah.
Okay. So you did get your bachelor's degree in psychology, Spanish, and Latin American studies at the University of Melbourne. So tell me about that thought process.
Yeah. So it's interesting, in Australia, most people, when they finish high school, they just go to their local university. They don't really travel interstate. I feel like in America, it's like, where are you going? Oh, I'm going to California. I'm going to Texas. It's something where you travel and you stay in college dorms and you have this whole unique experience. Whereas in Australia, it was not like that. However, I knew that I wanted to go interstate. So I decided to apply for the University of Melbourne, which was in a different state, and I got in. And I was so excited to leave behind everyone I knew and basically just learn, different ways of doing things, meet new people. Melbourne in particular is a very multicultural city. There's so many international students there as well. It was also the top university for psychology and for just the top university in Australia. Granted, there are maybe only like 15. And so that was something that was important to me, was to try to get the best sort of experience that I could. Granted, I only really started studying hard towards the end of my degree, and instead focused on the social aspects the first 2 years. So it was a great experience, though. I loved it.
Okay, fair enough. And you certainly mentioned like they had a great psychology program. So how do you pick psychology, Spanish, and Latin American studies? What was that thought process for?
So psychology was my major because I thought I would be a psychologist. I thought I would go all the way, to get the undergraduate degree, the graduate degree, become like a clinical psychologist. I used to work in a supermarket in high school, and I would tell everyone, I'm going to be a psychologist. This is my dream. So that's what it was at the time. And Spanish and Latin American studies was because my family speak Portuguese, but I don't. And I wanted to learn Portuguese, but they only had Spanish. And so I took on Spanish instead. And it became this really great experience where I got to do something for a career, psychology, as well as pick up something sort of fun, which was Spanish. And I really enjoyed doing both of those. Okay,
that's awesome. And then also during your undergrad time, you had a semester exchange at the George Washington University. So is that like typical for people in your program when you would know? So tell me about that.
Yeah, no, a lot of people don't. Like I mentioned, a lot of people don't even go into state. So can you imagine trying to go to another country? And fortunately, I had that same headspace of, I want to get out of here. Let me go somewhere else as fast as I could. So I had actually did not plan on going to GW at first. I wanted to get the authentic American college experience. I wanted to go to a big university with massive football games. So I originally tried to go to University of Texas and Penn State, but the timing just didn't work. And it was either GW or Connecticut, University of Connecticut. And when I asked someone about Connecticut, they just said, there's a lot of cows. And I thought cows don't really make sense to me. So why not GW? Funny enough, GW is one of the universities that doesn't have a football program at all. So that crossed that off. But it was a really great experience because I was able to live in a dorm with different international students, and we had a lot of fun times exploring the area together. We had like a really great cohort of people. So I really enjoyed it.
Okay, and what year in school were you when you did this?
I was in the second half of my second year.
Okay, second year. And did you do any like specific classes?
So it was interesting. In Australia, we only had 4 classes a semester, but they were quite big time commitments. Whereas in America, it was more common for people to do 5 to 6 classes, but they were smaller time commitments. So I took basically all the same classes that I would for my regular degree, although I did add on stress management, which was honestly an opportunity to do homework that consisted of meditating. And I also took a really cool psychology class called Attitudes Towards Death and Dying, which sounds very morbid, but it was actually a really cool way to explore like a sort of taboo topic. For example, we had to write our own will, and we had to learn about how you would prepare someone to go into a coffin and have a viewing. So we learned about all of that as well. So I had an opportunity to explore new things, which was great.
Yeah, that is quite interesting. And during your time, you also were a graduate or undergrad research assistant at GWU. So what did you do in that?
Yeah, so for that one, I basically approached my professors and said, hey, I want to get more experience and work in your lab. And I was supporting a brain and vision navigation lab. So I was with some other students basically in a dark room, and we would set up objects and change the position of them so that when people would come in to view them, we would change their depth perception and change the lighting. And basically they would tell us estimating where something was in the room. Basically, we were manipulating the environment to change what people could look at. And it's interesting because that whole experience is not common in Australian universities. We don't really have this experience of doing undergrad internships and supporting professors. It's more something you have to ask to do. So I was really fortunate that I was able to take part in that.
Okay, that's awesome. And do you think your experience going to the US was worth it, looking back on it now?
Yes, absolutely. I think it was amazing because it was like I was studying at university, but I was more so having a holiday. Like I think a lot of people who go on exchange have that experience where they really just take the time to enjoy different things happening in the city. For example, when I was there, I was able to go to the White House and visit the White House. I was able to meet, what's his name now? I completely forgot. He does Bill Nye the Science Guy. I got to meet him because he came to awesome. DC and did a book signing. And also the standard, I think, of the university was, in terms of how difficult it was easier than Australia, as well as for a lot of the students coming from Asia and Europe. So we really you had students from Switzerland being top of the class in a US history class because they were taught, and we were all taught to have such difficult classes with a lot more, heavily weighted assignments, that a 10% quiz, that's nothing. Like I think we were able to enjoy the experience a lot more. And I really think everyone should, if they can, do some sort of exchange program.
Yeah, I definitely think it is awesome, especially if you don't get to travel a lot. I think it's a great way to get that travel while also going to school as well. So then you went back to Australia and you had some time as a research assistant at the University of Melbourne. So how do you get that, and then what do you do?
Yeah, so I was, I loved that experience at GW, but obviously, like I mentioned, it wasn't something that was set up in my home university. So I really just messaged my professor to say, hey, I'm interested in supporting your lab in any way. Let's meet for coffee. And we did. And he said, you could do this, you could do that. And I said, yes. And it just became this informal thing that actually led to bringing in more students. And it became a sort of formal program where others could come in and support the professors and the other PhD students in the moral psychology lab. Granted, moral psychology wasn't something I was super passionate about, but it was a great opportunity to get some practical experience when there were no opportunities that were formally set up in the first place.
Yeah, that sounds very, very awesome that you were able to like advocate for that, and then they also saw value in it to bring in other students. And I think that's something like anyone could do. It's like not something that it's not that hard. It's just like emailing professor and reaching out and asking for that. And then, as you said, you had the conversation and then you went from there. So what, like during your time in undergrad, what was your passion around psychology? What kind of psychology were you interested in?
So I really enjoyed the social psychology. So what was kind of going on in society and how that influenced our health, our behavior, bias, prejudice. I also really enjoyed the neuroscience classes because it was so amazing to me that just on that really basic level, there were so many things that were driving our decisions that we just haven't tapped into. So I just thought that was amazing as well. Our sound, our vision, how we communicate with each other. I always thought that was interesting. And I think a lot of people, they go into psychology because they really love kind of like people watching, or they like to know why people do things the way they do. So I think that resonated for me, but definitely more so on like a social level and even the biological, neurological level too.
Yeah, that's interesting. And I feel like there's a interesting like relationship between psychology, sociology, and public health. They all linked up on like just different levels of thinking about it, but they all definitely do relate when you do think about it on a like large scale. And were there any other takeaways from undergrad that you wanted to share?
Well, I had mentioned that I really didn't start taking it seriously towards the end. Halfway through, I thought it would be a great time to binge watch all of Supernatural. And there was no reason for that other than I was not taking my studies seriously. But the moment that I did and started doing my readings, it just made the whole college experience so much easier because I would come to tutorials knowing exactly what was going on. I learned really good study habits that I didn't do in the beginning, and it would make me stressed out, and I would, basically just neglect my studies, which really ends up being a waste of money and time. So I think when I started focusing and doing my readings and committing to that, it paid off. And the other thing was I really enjoyed doing extracurriculars, but not just for professional reasons, but for fun. Like I was in the Spanish club, I was in the surfing club, and sometimes you just need a break from university, and it was great to have some social fun as well.
Yeah, absolutely. And I definitely agree with that advice. Especially going into like my master's program, I feel like being able to read the content before, because I felt like the classwork was more talking about the things that were in the book more so than trying to learn it. Just like discussing it more than learning it. So you have to put in that work to learn it before. And I think that helps in any circumstances, just in general.
Yeah.
Okay, so you're coming to the end of your bachelor's in psychology, Spanish and Latin American studies.
Mm-hmm.
What's the thought process going there? Are you like thinking I'm going to get a job? Are you thinking I'm going to get a master's in psychology? Or how does like master's of public health get into it?
So I came into my bachelor's thinking I'm going to do psychology. That will be my career. I came to the end of it thinking, this is not for me. I don't want to do this. I don't want to be a psychologist. And really that left me with, okay, now what? You know, I couldn't commit to further study because I wasn't sold on anything at that moment. And so part of me had to think practically, like, okay, I need a job. So I just started applying for anything that would take a basic psychology degree. So a lot of admin sort of jobs, some market research sort of jobs, which was fine. You know, at the time, my goal was money. So that was my focus. But then I didn't want this degree to go to waste, right? Like I needed to think about where did I want to go next? And so I started to reflect on what was I really passionate about either at any point in my life. And I remembered how in high school in Hawaii, I had this really cool class called peer education. And we had the opportunity to learn about different health topics and teach our peers. So for example, we would go to schools and teach kids not to smoke by inflating, you know, a pig's lung that was healthy and a pig's lung that was not healthy. And of course, the one that wasn't healthy wouldn't expand. And we also would do role plays of teenagers going to a party and, you know, a girl's hitting on them and how do they respond? And that was really fun because it was in Hawaii. So we were using like pidgin and like, oh yeah, brah, I don't know what I'd do, man. Like it was very contextual, I suppose. So I really enjoyed that. So I started to think, what is that? It wasn't psychology. I knew that. And when I looked into it a bit more, I saw that psychology had this subsection called health psychology. And I was looking at it, but it seemed still like too individual focused. And then somehow I found out about public health. And I thought, okay, this is perfect. That was what I was thinking about in high school was like health promotion. So that comes under public health. And so I decided to apply for a Master of Public Health in my hometown back in Brisbane. But I would do that in a year. So during the year, I decided to instead work and still kind of explore what public health is so that going into it, I would have a better idea of where I'd want to go with it after the degree.
Okay. And I think like that is all valid. And I think a lot of people are probably in your same position thinking about, yeah, I want to do psychology. And then it's like, oh, this is way too individualistic. This is not what I wanted to do. And yeah, public health is always a great thing. We love, and I feel like that's the one thing about public health. Like even it doesn't really matter what kind of like bachelor's degree you have. I feel like you can bring something to public health and always like bring it back to, okay, this is impacting the health or the community's health or something like that. So yeah, once you get to public health, we're all happy. So you got your master's of public health. Oh, I actually wanted to ask, is university in Australia expensive for locals, or is it because I know I had friends from high school in the Middle East who went to school in Australia, and it's very expensive for them as international students. But
yeah, as an international student, I would definitely say it's expensive. As a local student, my bachelor's degree worked out, granted it's an arts degree, so it's a bit cheaper than some of the others. It works out to about 25,000 for the whole degree. So it's definitely a lot cheaper. And we also get a sort of subsidy where we don't have to pay it off until we are making a certain salary, and which sort of gets indexed every year based on general salaries. So it's really great if you're someone fresh out of your degree who maybe didn't go where they wanted to go and needs some job security by just picking up jobs where they can. It helps you to do that and not have to worry about like loans and things like that.
Okay, thank you for that. Okay. So you went and got your Master's of Public Health at the University of Queensland. You said you did it in a year. What did you have a concentration?
So it was a year and a half.
Okay.
Generally, most of the masters are 2 years, and I did not have a concentration. I actually didn't like anything enough to concentrate in it.
Okay, so you're just like a generalist. Yeah.
Yeah, it was a general one. However, I had the opportunity to do either a project or a dissertation, and a project was essentially a smaller dissertation. So I did that coupled with an elective that was a research elective. So essentially, I did a sort of research concentration without it officially being called that.
Like that's awesome. I like the flexibility and like the way you're able to mold what you want. And I think a lot of programs are able to for the most part. And that's awesome. So during your time during your MPH program and during like your projects and your research and learning, did you find out more about what you wanted to do in public health?
Yeah, the great thing about a master's degree is that I think it really values what you bring from your different disciplines. So, I was in a class with doctors and nurses, and one of my really good friends was a dentist, and he just told me he was really sick of looking at teeth. So he was here in public health. And I think for me, I kind of went in knowing I'm really passionate about sexual health. So any of my assignments that I had, if I had the opportunity to pick a topic and write about it, I would do that, and focus on sexual health, and that's what I did. So that was great for me to kind of refine that going through my degree.
Yeah, that's awesome. And I feel like that's also something like just in general, especially like for me looking back on my degree, I did a lot of my projects on like Trinidad or Trinidad's health system, and that's something that you can do, and it helps you to become like an expert or a subject matter expert on certain things if you just continually building on learning that one thing and like using it for different projects and taking different angles and things like that. So just a note out there. So did you have any other takeaways from your MPH?
I think one of the really cool takeaways was that my cohort was so diverse. So it was a great opportunity to learn how other people from different disciplines approach the same problems. Because when you get out of the degree and you do go into public health work, you are working with people from different disciplines, and it's not an us versus them mentality. Like I never went in thinking I have a psychology background, so I know how individuals think better. It was more about, well, some people have some experience here, some people have experience elsewhere, and it works better when we bring in all of our knowledge to try to solve these problems, which we all know in public health are quote unquote wicked. So they're very complex to deal with. So I think for me, it was more so learning about how to work together with other people and acknowledge what they bring to the table.
Okay, and I like the quote unquote wicked. I appreciate that. So you graduated, and did you graduate and become an administrative support assistant at the Lowitia Institute?
That one I did in that gap year. So that was one of those, need something to do. And it was actually in a research field. So that was great for me going into my master's. Granted, I was doing admin, but I was in a research environment. So I still had some knowledge that helped me to figure out that I liked doing research later in my Master of Public Health.
Yeah, and tell me more about that. Like, what did you learn from taking that gap year before your MPH?
The gap year was interesting because I really had to think about what did I want to do for my degree. I had to spend that year figuring out like what did I like, and I think not everyone takes gap years, but I think they're so rewarding. Even 6 months, even if you're straight out of high school and you can take some time off, like I think it just helps you to solidify exactly what your interests are. Sometimes you do have to go through that process of going through the degree and maybe realizing it wasn't for you, but if you can take some time off. I know a lot of people travel in Australia. They'll take a year off to travel, or 6 months to travel, 6 months to work. I just think there's so many benefits, like how I did the exchange program. You just get to learn more about yourself. I mean, it essentially prolongs the time before you commit to a career that you're somewhat looked into for some time. So the most time you can take to find out what you're really interested in, the better, I would say.
Yeah, and I feel like especially if you're not really sure what you want to do, then it just gives you that time to really think through it and also get those experiences and maybe meet new people to really mold and understand what you want to do. Yes. So the jobs that you had at University of Queensland, were these during your MPH as well?
Yes.
Okay, so you have a lot of research assist. You have a summer, a winter, and then like a regular research assistant position. No, you have summer research scholar, a winter research scholar, and then a research assistant position. So yeah.
I'll break it down. So I had mentioned earlier that internships are not super common in Australia. It's not something we really do. But the reason why I chose to go to this university for my Master of Public Health was because they had this really cool research scholar internships during the summer and winter breaks. And so I decided to do those, one halfway through my degree and one right at the end. And it was just an opportunity to do research work on a topic that I was interested in. The summer one essentially was 10 weeks, and it helped me to get deeper into my topic of interest, which was sexual health. So I was able to co-facilitate focus groups with Indigenous women in Australia about what they know about contraception. And what's cool is from that, it became a paper that got published later. And then the winter one was more of me conducting interviews with students to find out how we can improve some of the curriculum that they were learning. So just really practical sort of things that kind of help you post a degree. I was also a tutor with my American accent. And that was great because I felt like because I had gone through the process in my undergraduate degree of not studying, then studying hard, so that when I came to my master's, I knew exactly how to tackle assignments. And I think I did very well so that I was able to then tutor other students and give back to them and teach them really good study tips. I also, during that time in my MPH, facilitated a book club that we started, and it's still ongoing. And that was a really fun thing to do. It was just something I pitched to someone else, and we kind of got together and rolled that out. Universities, I mean, everyone tends to be, thinking about knowledge and books and learning. So that's something that anyone can really do. And then I was also a research assistant right as I finished my degree. And that was an opportunity that was just like 3 months, something just to hold me off until I got to the next place I was going to go to. And that was about writing, kind of assessing the health curriculum and finding out where the gaps were, and writing a report about it. So stuff that was kind of easy to do following completing my degree. It wasn't too difficult.
Okay, awesome. Well, thank you for sharing all of those. Was the Aurora intern at Griffin University, was that also during your MPH, or was that later on?
So that was right after I finished my time at the university. So I graduated, I did the research assistant for like a couple months, and then I started this 6-week internship program.
Okay. Well, I also didn't want to I didn't want to miss you saying that, like, you just pitched the idea of someone, the book club, to someone, and then you got running with that. And I think that's something that people don't think about either, is like, if 2 people come together or a couple of people come together and have this idea and they take it to the school, 100% of the time the school is going to want to support that. And because I feel like it just goes back to, it's like a reinforcing loop. If you're doing well, the school does well. If you're able to start like new initiatives, and as you said, like it's still running to this day, so that's awesome. So always try to do like things that you want to do, and if there's a gap for it and there's a need for it, then do it. Yeah, and then tell me more about the Aurora intern at the Griffin University for 6 weeks.
Yeah, so that one was interesting because that one was actually at a different university, in a different part of town. It was 40 minutes from my home. So I had to figure out how was I going to live somewhere for 6 weeks. And fortunately, I was able to get funding from the internship to either stay like in an Airbnb or something like that. But we had I call it a caravan, but I think in America it's like an RV. So I just stayed in an RV park for 6 weeks on the beach, and that was my accommodation. And I had borrowed my a bike, and I would just bike 20 minutes to the university and do this internship. It was a lot of fun. I basically was able to insert myself into an Indigenous health center at the university and support some ongoing research projects using the skills that I had developed from my MPH. Actually, my very first thing I had to do for the internship was fly to another city and go to a community sports game and work on promoting some of the health programs that was offered by the university. So you just have to get off the plane and go put the hat on and get some water and just do what you got to do. So I really enjoyed that. That was a very practical experience.
Yeah, that sounds awesome. And the RV on the beach, that sounds awesome as well. I would have loved to do that. And then after this position, so you moved to the US after this? Is that what happened? Okay.
Yeah.
And what was that process like for you?
So that process was interesting. Basically, I've been in a long distance relationship with my now husband all throughout my degree. He's military, so he couldn't leave. And I was like, you can wait until I finish doing my studies. And so I finished my studies, and the goal was I would move over. But of course, I needed to do an internship. I needed to work a little. I wanted to tutor a little because it would set me up for going to a new city where I had no contacts and no networks, was to have as much experience as possible to add to my CV. So I basically, during my internship program, actually, I started looking at jobs in Tucson, Arizona, where I was headed to. And I found one and I applied. And a week later, I got a reply saying, I'd love to interview you. When can you come? And I had to reply back to say, I'm actually still overseas, but I will be there soon. So I was able to move and go for an interview straight away. So that was pretty cool.
Okay. Was that the same job that you got?
Yes. So that one was the program coordinator at the University of Arizona first. And then I had another role after that as well. But yeah.
Okay, that's awesome. Well, like kudos for you, and I think that well, congrats on like the long distance relationship, and then meeting up with your now husband. That's awesome. That big congrats to you on that. That is really awesome, and yeah, that's awesome that you're just able to like go on your computer, search for a job, almost get an interview while you're still in Australia, and then get one when you get there. So what kind of things did you do as a program coordinator at University of Arizona?
Yes, that one was great because I was essentially working on a project where we had received some grant money to run a fetal alcohol spectrum disorder program, or FASD, with a local Native American community group. And my supervisor had previously worked with a Indian health service in the city. So we basically approached them to say, hey, we have this funding about this topic. And because I had some experience working in Indigenous health, that was really an asset to the project. So we came in and basically saying, listen, we have this money with this for FASD. What do you think? And the project was essentially community driven. So we asked the directors of the health service, do you think this is a topic worth exploring? They said yes. But then they said, you have to ask our community groups. So we attended all of the community groups, like a walking group, a sobriety group, like those sorts of things, and went to them to say, hey, do you think this is something you'd be interested in? They said yes. And then from that, we were able to design a survey and conduct some focus groups with men, women, elders, and young people. and get some data to essentially design a program to work towards improving or reducing FASD.
That's awesome, and it's awesome that they saw the value in like your transferring of indigenous knowledge from Australia to the US, because definitely is a lot of similar I don't want to say issues, but like barriers that have come up from how societies have treated those First Nations people. Yeah, and like I feel like a lot of the work that deals with First Nation, I'm just gonna call them First Nations people, is very like community driven, and like I feel like they are very a good example of what public health should be, and we should listen to and learn from a lot of what they do. Even like during the pandemic, it's been amazing to see a lot of the response from a lot of the different First Nations peoples around the world. So yeah, thank you for that work as well. And you were also a survey interviewer at Mathematica Policy Research. Was that during the same time as this?
Yes.
Yeah.
So the program coordinator role at the University of Arizona was part-time. So I needed to supplement it with something else. And so I came across this role. I hadn't really done just strictly phone interviews. I was more of an in-person, let's talk about things. How do you feel? From psychology, I had the psychology linked in me. But it's funny because after doing that survey, or while doing that survey interviewer role, in my current job with our University of Arizona, I had to design a survey. So it worked out well. It was kind of yin and yang, and it fed into each other. So that was nice to have that balance.
Yeah, that's awesome. And I feel like a lot of those kind of skills in public health are very transferable, and you're going to use them in different things. Because like a community health needs assessment is it's very valuable, but it contains the same things like data and analysis, focus groups, surveys, and it's like that same thing repeated over and over. So like just learning those skills, I think, is just so valuable to especially early career public health professionals. And then after these, I don't know if it was after these two jobs, but the next job that you had was a research administrator at the Comatics PT Limited. I don't know.
So I'll explain what happened there. So my husband, being in the military, he got orders to Japan. So I had to leave my jobs and move to Japan. And basically I was in another country and I had all these research skills, public health skills, but I was in an environment where, one, I don't speak the language, and two, it's mostly military bases out here. So any jobs I could get would be feeding into that environment, which wasn't a university environment. And so I had to call on my networks in Australia to see if anyone had any work that I could potentially do, especially because there's only an hour time difference in Australia. And I actually went to Twitter and said, hey, I have XYZ skills and I'm looking for work. Send. And I had to see who would respond. And I had my then supervisor from that organization reach out to me to say, hey, I have something you could potentially do. Let's talk about it. And that led to some short-term work that I could do online, which was great.
That is awesome, and shout out to Twitter for helping you to help me get that position. And do you speak Japanese now or no?
Skoshi, which means a small amount, but no, I can say lots of different words, but I can't put them into proper sentences. So it was never going to be an option for me out here.
Yeah, fair enough. And how long ago was that move to Japan?
That was in end of 2019.
Okay, so not too far before the pandemic then.
Yes, yeah.
That might have also created some interesting things for you as well. So like during your thought process working this job as a research administrator, how were you thinking about like your career? Because you're in Japan, you don't speak the language, you clearly have like the network to work on like remote jobs in Australia, which is an hour time difference from where you are. So like what are you thinking right now for your career at this point in time?
Yeah, it was interesting because it was like, okay, another moment where I'm in this position where I'm not really sure what's next, but I kind of know myself better and what I will and will not do. And so I had tried to secure employment out here just to make money. But as I was doing that, I realized that that wasn't my passion. It depends on where we are in life. Sometimes we need just to have a job just to make money, but I was in a position where I could kind of sort of cherry pick when I wanted to do things and kind of do some networking and find out from other people how I could support to do work that I was interested in. So my headspace was try to do as much work where I could build my research skills and stay in the public health sphere somehow. So that meant I became more of an active member in the public health associations that I was a part of, so the American one and the Australian one. And because I was overseas on a computer, I basically reached out to them to say, I can do your social media if that's what you want. And I was able to do that voluntarily, but still building up some skills and still kind of being a face in the sector while being away from everyone in another country.
Okay, yeah, that's awesome. And I think that's great insight for someone who might be in that same position in their journey right now. And yeah, thank you for sharing that. So after that, you were an independent consultant at the University of New England on the Daalbirrwirr Gamambigu, which is Safe Children Project.
Good job.
I thank you. I practiced it a couple of times before the interview, to be honest.
Yeah.
So how do you come across this? And New England, as in the USA, New England?
No. Believe it or not, it's in Australia as well.
Okay.
So that one actually came about from that first research administrator role. It was just that supervisor got contacted by this other supervisor saying they needed someone, and he recommended me. So that's literally how it came about. And I was able to step in and support writing and cleaning up a review and a report so I could use those research skills that I wanted to keep building. So that was really through having contacts and networks, which really saves you a whole process of interviewing and, that whole thing. So that was great that worked out.
Yeah, that's absolutely very, very important. And tell me more about that, because you're in Japan, you're working in Australia. What does like networking look like for you?
I think for me, it's really about being active in your different fields. So for me, public health and being on social media was great because I didn't need to be in the country for people to see that I was being active. I could be active on social media, which is how that first supervisor found out about me. So it was really about making sure I was making ongoing contributions and commenting, I guess, on public health issues on social media, as well as making a really good LinkedIn profile so that if anyone could look up me, they could see all the stuff I was doing, even if they could physically meet me. So I think those two things are really important for me. I need to get new headshots again, I think.
Awesome. Well, I look forward to your new headshot. And then since you already mentioned your LinkedIn, I'm going to ask this a lot later on, but for your LinkedIn profile, you have your profile set to the United States of America. Tell me about that thought process.
So that process is because I wanted to connect more with people in the United States in terms of building my network there. I feel like I've got sort of good connections in Australia because I'd lived there most of my life. But when I'd come to America, I didn't really have that. So I've just consistently been active and adding people in the United States. But if they see I'm in Japan, they might think, well, this is a bit strange. Well, I don't know anyone in Japan. I mean, they don't know me at all, regardless, but it just helps to show that I'm someone that at least has worked in the United States and knows what's going on in the United States by virtue of paying attention to the issues, advocating, supporting the different organizations that are US based. Yeah.
Okay, yeah, and I thought that was fascinating, and that's why I had to confirm before the interview to make sure that you're still in Japan, but you are, but you are. And then you were also a freelance research consultant at the University of Arizona. So how did that come up now? That's not in Australia, I'm guessing.
No, so that one was from my previous role working as a program coordinator at the University of Arizona. And my supervisor said to me, are you still interested in supporting the work that you started even while you're overseas? And I said, of course. And that was mostly, I think, due to one, having a good relationship with my supervisor. You never want to burn bridges because you never know if someone's going to refer you out to someone else. And two, I think my supervisor and I did really good work with the project and with the community. So I think that led her to think, I'll bring you on again to support doing some of the writing up the findings and now writing a paper based on our first work. And I'm actually doing it again soon for another project. So yeah.
Yeah, no, that's awesome. That definitely shows the value of having a network and having people that they know about your skills and can really advocate for you. And when they know there's an opportunity to bring in someone who probably isn't a full-time position but can help with the work, they know that you're there. So tell me, how do you keep connected with these people? Is it just that you keep a presence on social media and then probably reach out to them every couple of months, or how does that work for you?
Yeah, if it's something where I'm working with them, like with University of Arizona, we just have ongoing meetings. I mean, I even sent her a package from Japan of sweets for her kids because why not? So I think just constantly keeping sort of connected over time is great. Sometimes when I had those other jobs, I needed a reference. So I would have to reach out to previous people and say, hey, I need a reference. Is that okay? How are you? How are things going? So that's great as well. And then I guess with professional organizations, just constantly, contributing as much as you can, and people will see your name and know that you're someone that they can potentially call out on for support.
Okay, yeah. And I think that's all great advice. And yeah, definitely keep in mind that you are for the most part, gonna need someone to be your reference when you are getting a job. So definitely make sure that you're keeping those connections alive and not just always speaking to the person when you need something, but just asking, hey, how are you, checking in with them just to see how everything is going as well. And you're also a Native American researcher from City Programs. So tell me about.
No. That one's just everyone who has to conduct Native American research for the certificate has to do some sort of training. So that one was required by the University of Arizona at the time. I'm just kind of learning about ongoing history, research, sort of injustices in the past, sort of common issues, so that you're not going into any sort of research with community groups, not knowing context. Yeah.
Okay.
Yeah.
Yeah, and that makes a lot of sense. And I feel like that should be training that everyone should have, should be mandatory in all schools. Okay, so it's not a job. It was just a program to get to find
listen,
something.
You add everything you can to your LinkedIn profile. You just add it all in.
Absolutely. Are there any other advice you have for people on LinkedIn?
Sometimes I think people have there's a little sort of debate where people are thinking, do I add every single person that I can working in my field, or do I make meaningful connections and connect with a smaller group of people, but actually reach out to them to potentially lead to a conversation? Now, because I'm straddling multiple countries, I have gone with the former, which is add everyone, because one, it opens up your network so that more people can see you. And two, I don't actually have the time to connect with everyone, but when I do, at least I know I have that connection if they've accepted it. So it really just depends on your situation, but I definitely think it is a really great tool that more people should use, because it really is a way for you to show your professional side. Whereas if you use like Twitter, I think more people use that more for rants and funny pictures. So I think it's definitely underutilized, and more people should use it and get a really good headshot if you can.
Yeah. You definitely have a really great headshot. So, and I look forward to the new one coming out as well. But yeah, I think LinkedIn is definitely a great resource for everyone in the professional sphere, especially in public health. There's so many great people that you could connect to. And fun fact, like LinkedIn now has this like feature where you could do video chats through LinkedIn, or you could integrate your Zoom or Microsoft Teams, which is pretty awesome as well. Yeah. The only thing that they are missing is that you can't like send a calendar invite for when you do send the Zoom or LinkedIn video thing. Yeah, but it's pretty awesome. I actually spoke to someone in Thailand today using it, which was my first time. And I thought this is really cool. It's gonna make like informational interviewing a lot easier and just a lot quicker. So I'm looking forward to using that more, and hopefully other people use it more as well. And then you became a seasonal tutor as well as a research assistant for the University of Queensland.
Yes. So that one, the tutoring started, but then it ended because I thought my student ghosted me because I never heard from them. And I thought I was a horrible tutor. You know, I took out the library books and statistics because I wasn't perfect, but I knew something. I just needed something to fall back on. But I found out 6 months later that the student had just actually decided to take the semester off and just forgot to tell me. So the whole time I was worrying about whether I was good enough. So that one kind of ended. But I did pick up a research assistant position with someone who I had actually known from before. And it was something where they approached me to say, hey, I have this potential role. Would you be interested? And I said yes. And that one was great because I was able to interview Indigenous students to find out how they define success in completing university, as well as identifying how to support them to be more successful. And because those were interviews, I could just do them over the computer because one, the time difference, two, COVID. And that was great. I was able to go through the whole timeline of a project from starting the ethics application to doing the interviews to writing a report. So that was nice to finish up actually this week.
Okay, that's awesome. Well, congrats on finishing up. And I just think like this entire interview just goes to show you how you're able to like just work remotely and really find those connections to get those jobs if you really want to do that, or if you have to do it in your case. And I think a lot of people don't even think about those kinds of things that they can do and reach out to people and like just continue to reach back on your network to see what kind of opportunities part-time that they can give you. And yeah, I think that's awesome that you're able to do all these things and continue to stay connected both in Japan actually, and then Australia and the US as well, which is really, really awesome as well. And so your current position is a policy project officer at Marie Stopes Australia. So what is Marie Stopes Australia, first of all?
So Marie Stopes Australia is essentially like what we might think of in the United States as Planned Parenthood. So they have clinics and they provide sexual and reproductive healthcare services, as well as just general sort of advocacy research in the field as well. So it came full circle.
I know. I just got goosebumps there. I was like, no way, this is awesome, because now it's like the sexual health that you're talking about during your MPH. Now you got to do it.
I know. But you know what's funny? It was one of those things again where it was based on my networks. So I had reached out to an old contact from my MPH program doing that research project, who's a female doctor, and she provides contraception services. I said, here's my resume. Do you know of any opportunities, anything that I can contribute to sexual and reproductive health? little did I know she sent it out to all her contacts. And so I was then contacted by someone from this organization who said they might have work for me. I said, okay, we'll see. And then it led to another conversation saying, maybe you can come just start as a volunteer. And I said, all right, I'll do what I can. And then it turned into a, hey, we actually have work for you, send us your resume and all of that. And then it became a role. So it was one of those things again of connecting, networking, being persistent. And now it's led to something official.
Yeah, that's awesome. That's really awesome. I'm really happy to hear it came full circle and that you're able to work in sexual health, because I know that's something that you're very passionate about. It's something that you either post about on LinkedIn a lot, or like you're liking or responding to people that are posting about that. So it comes up on my feed all the time. So yeah.
All right.
So what do you do in this position specifically?
Yeah, so with this one, it's definitely a little bit of not in community settings or the community level, but more of like research, advocacy, policy, contributing to research papers. I was able to contribute to be a speaker on a panel at the Sexual Health Conference in Australia for a new day they created called Sexual and Reproductive Health Day. So little me was asked to talk amongst like the CEOs of these top sexual health clinics and organizations. And I actually got to talk about not my job, but actually a topic I was interested in, which is reproductive justice. And that was kind of my opportunity to talk about and introduce what it is in an Australian context, because it's definitely something that's more well known in a US context officially and as a theory. So that was a really cool opportunity to do. And then I got to write like a blog post, so that was fun. Found out though that I speak way too academically in writing. So I had to kind of shift how I speak a little for a new audience. So still learning new skills, but in the area that I'm passionate about.
Yeah, okay, that's awesome. And yeah, I feel like when you do a lot of like academic writing, it is hard to translate that to like blog form, kind of like informal people to read. But then I feel like when you're able to master both of them, you can get like a healthy combination where it's like some of it, like I was reading a report there and part of it just sounded so poetic. I'm like, is this even like a research report right now? But okay, so talking about speaking in front of all these people, and it seemed like that was a big thing for you to overcome. How did you overcome that and were able to persevere through that?
Well, one, I wore this really great orange blazer that is also in my LinkedIn headshot. So, if you can wear something that makes you feel confident, that definitely helps. And also I, on the side, am a member of ToastMasters, which is a public speaking group. So for me to give a presentation online, I already do that for fun. So I just treated it the same way, where I would write a speech and talk to the camera and record myself, make sure I was practicing, and basically just delivered it like I would for my Toastmasters club. So I think it worked out pretty okay.
Okay, I like that. I like the wear your confident clothes and make yourself feel good, and that's all awesome. And then I also want you to speak on like reproductive justice from the Australian perspective. Give us like a little 101.
Yeah, so it's interesting because we have, like I had mentioned before, like two main Indigenous groups in Australia, and there is, similar to other places in the world, like the United States and Canada that have been colonized, that history of reproductive injustice in terms of issues in terms of healthcare, not providing adequate healthcare, removing families away from each other, like that all contributes to like forms of reproductive injustice, which is really around the right for people to have children, not have children, and parent their children in safe communities. So if there's like constant threats to healthcare and just your way of life, that becomes an injustice. As well as we have other issues with people who migrate to Australia, migrant and refugee communities, and how they may access or not access healthcare, reproductive healthcare, and similar to other places as well. You know, we have things where, you know, maybe people in prisons can't access adequate healthcare, or maybe how they have children and give birth is not entirely the right way of going about it, where they're prevented from caring for their baby when they're born. So, but also good things too. We have some really cool programs in Australia called Birthing on Country, where we have Indigenous people who will go back to where their country is, like where they're from, and give birth to their baby there. So it helps to improve outcomes for the parents and the baby. So that's a really cool thing as well. But I think it's definitely something like as a theory that is still being developed in Australia, but we definitely look to the United States for inspiration because there's so much great work being done there. So I think it will rely on a bit of collaboration, and hopefully I can contribute to that.
Yeah, absolutely will. Yeah, absolutely will. And that's awesome. And I'm glad that you're able to do that work. And it definitely seems like you're fired up about it. And then you've also been in this role for I think like 3 months, right? Am I right?
What's that?
You've been in this role for like 3 months.
Yeah.
So what has like, because you said you went from like it was a volunteer to like a part-time to a full-time position, as well as you're getting this role during COVID. So what has like that onboarding and like going from volunteer to part-time to full-time look like for you?
Yeah, I think part of it is really trying to figure out, again, you don't just do this at high school. You don't just do this when you graduate from your first degree. You're always constantly trying to figure out what do you want to do and how will you get there. So I think for me, it was just about having really clear intentions of what I wanted to do for work and what I'm interested in. Before I started this role, I also completed a sex educator course that was offered online from America, which was perfect. There's so many opportunities now online and virtual. So even if you're in a different state, you can access. Unfortunately, that meant for me waking up midnight to 8 a.m. to do a class. Totally worth it. But through that, I learned some of that practical sexual education knowledge that I didn't get from psychology or public health. And that has then fed into doing this current role where I'm able to articulate what my interests are and then also write about them by having that new knowledge.
Okay, and yeah, that's awesome that you had the dedication to get up at midnight.
It was hard. It was hard. Let me tell you, I had to practice. Obviously, I couldn't just wake up. I needed to wean my way into it. At one point, I was just staying up, pulling in all night, and I just was like, let me repot my plants at 2 a.m. And I felt like I was digging up a body or something because I was just digging in the dirt at 2 a.m. But these are the things you got to do sometimes to commit to the things you're passionate about. So it was worth it.
Yeah, absolutely was worth it. And as you said, like it's a free course, and if you're willing to get up at midnight and struggle for a little bit, you're gonna be better off later on. So that's great. Great that you're able to get that. And then you also spoke to this a bit that you are in Toastmasters. So you are in the Oki Orator ToastMasters club. So talk about like why you wanted to get interested in Toastmasters. What sparked your interest in this?
So I had tried Toastmasters in Tucson, Arizona, with just like a general club in the city, Tucson City, which is very small. And I didn't like it. It just felt so fake and forced. People clapping every time after people were doing the bare minimum, so I thought. But at the University of Arizona, there was a Toastmasters club, and it was for people working in health and research. So I was like, okay, these are my people. The great thing about Toastmasters is they have different clubs for different groups of people and interests. So that was great because then I could see how people gave speeches for when they did things like present at conferences. And that was something that I was familiar with. Like that was my world. So I joined then and I started it and it was great. And then I moved to another country, Japan, and doing public speaking in a different country with people whose first language is not English really changed my perspective on how to communicate effectively. I had to learn how to speak slowly and spell out topics that may have been difficult already for lay people, but also for people who may not be familiar with it at all. For example, I recently gave a speech about planning a baby shower. At the end, the Japanese member said to me, "We don't have baby showers in Japan." So when I said something about planning for a baby, they thought I meant I was planning for a baby. So I had to tell them and clarify that. But really, it's gave me the opportunity to just get more confidence even. I also have been able to talk a bit on the local military radio here, and that has helped me talk better, I think. And then, of course, it led to talking now in my current role where I got to present at a panel and just do that without a lot of those nerves. So I really recommend it for people, even just to try. You don't have to commit to it. You can just see if that's something you're interested in. But of course, there are other courses and I don't know, YouTube videos on public speaking. But granted, we are still in a pandemic or Panic at the Disco or Panorama, and a lot of things are online. So the more we can communicate effectively online and not have to worry about the stress of being in person and worrying about, are people looking at me and what am I wearing, the easier it will be to give more effective speeches and communicate when we do get to that stage of being in person more.
Yeah, that's great insights that I didn't even think about. It's like this is a great like training period that you're gonna have to be online for most of your talking engagements, and then hopefully less than a year.
Mm-hmm.
Wood,
I know.
in person, you be able to do those in-person ones like flawlessly, or feel like just more confident in yourself in doing that. So that's awesome. And I know like a couple other people that have recommended Toastmasters as well. So I definitely appreciate you sharing that as well. And then the other thing that I wanted to ask was, so you've been to a lot of different places. You've worked from Japan and a bunch of different places. What advice, like I've spoken to, like just recently, I've spoken to someone who's only, I think, been to 3 states and they have never left the US. Like, what advice do you give to people if they're like scared to move to, maybe it's not even another country, but another state to do work or something along those lines?
Yeah, I think having a bit of stress and fear is normal. I mean, when I moved interstate from high school to go to college, I didn't know, where the local grocery store was. I got sick once and I didn't know who to rely on to come and give me vitamin C tablets, that sort of thing. But I think, with anything, with any move, with any job, there's always going to be a period of transition. Things will be a bit uncomfortable, but then it will get better if you just let yourself go and try to enjoy it. So I recommend, getting out of your comfort zone if you can. And I don't think, and you may even do it and realize this is not for me, but at least you took that chance to see if it was something for you.
Yeah, absolutely. 100% agree with that. And I think like it is important to like get uncomfortable sometimes, because that's where you really like learn about yourself and able to reflect and grow from there as well. So where would you like to see yourself in the future?
I don't know. That's such a hard question, hey?
Besides your black belt, of course.
That's right. I forgot about that. Yeah, black belt for sure. You said in the future?
Yeah, it's open. Like you can decide the time frame.
Okay, I think I will have eventually a black belt. I will have finished Toastmasters to the point where I won't do it anymore, because I think I will have gotten what I need from it, because sometimes you only need to do things you need to do for that time and then you can move on. And I think that I will have a couple of publications because I do like working in research and research projects. And I think that I will have, I'd love to give a keynote presentation at a conference. I think that's the next step, right? Like you start as a student going to them. This is if you're in a research sort of minded. And then maybe you get to give a poster presentation, then you can talk, and then maybe you can lead one. So I think that would be my ultimate goal. Hopefully my orange blazer is still around by then. We'll see.
Yeah, that's awesome. I like those goals. What are you trying to get out of our Toastmasters right now?
Honestly, right now, the great thing about it is that you do a specific pathway. So it's like a specific goal, and mine is leadership development. So I'm having to complete projects related to that. So some that I can do now are things like, how would I write a compelling blog post, or how would I lead a podcast, or how would I manage teams effectively? So I think right now I'm just learning different skills, as opposed to like just giving a topic and practicing how I talk and not saying that sort of thing. So I think it's about learning different skills that hopefully I can add to my current role and excel there.
Okay, awesome. And I feel like just orating is such an important thing, because no matter what you're doing, for the most part, you're gonna have to like sell yourself, or like sell what you're doing through like speaking for the most part, or through words at least. So it's not gonna hurt you in the long run that you're doing this in any way. And I definitely think it's going to benefit you a lot. And yeah, I know about all those ums and ahs and all those things. So no worries there. So moving you on to the Furious Five, the 5 question I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Public health is so diverse. People do public health in all sorts of ways and don't even know that they are doing it. So for me, I would say try to find out what you're really passionate about, like what lights a fire in you, what is something you would do for free, and try to explore that, talk to people in that field, see what they do for their job, try to volunteer if you can with organizations in that space, and just see if you like it. And if you like it, you'll probably love doing it as a job.
Good advice. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
I would say be yourself, because that was really crucial to the networking that I did. So if people like you, they're going to want to bring you on. You have to show your best self, online and offline. So that's what I would say.
Number 3, what's something you're working on improving in your life right now?
I mean, a couple of things, but I think for the most part, I'm actually really trying to read a lot more and take time off the computer to get back to reading not just fiction where I can escape into stories and escape from COVID, but also nonfiction where I can learn about topics that I think are important, like things related to reproductive justice, but also just like finance. I think those are important to always keep learning about. It's a lifelong journey.
Yep, absolutely agree with that as well. And number 4, professionally, do you recommend anything?
I mean, I've said it how many times now. I would say Toastmasters is a great opportunity for a lot of people interested in building their confidence in public speaking. We're all communicating in some way or another in our jobs, in our personal lives. And if you can communicate more effectively, you can, essentially make change, really, depending on where you're working.
Okay. Yeah, I think that's great advice once again. And last but not least, where can people connect with you?
Well, you can't come and see me because I'm overseas, but I do have a LinkedIn account with my name, Brenna Bernardino, a Twitter account with my name, Brenna Bernardino, without the O because it didn't fit. Thank you. Thank you, Portuguese long last names. And that's about it. Instagram's for fun. We keep that for funnies and memes. So just Twitter and LinkedIn for now. And I have my emails on both of those as well. So
yeah, awesome. Well, I will definitely be sure to put that in the show notes so people can definitely follow you and connect with you and just get your perspective all the way from Japan and sharing it all around the world, because we definitely appreciate you. But thank you so much for taking time to come on the show and really share your story and everything that you've done and you're doing. I really appreciate this.
Yeah, thank you so much for having me. I mean, I was a public health student once, and this is the exact sort of thing that I would have loved to have known then, now.
Yeah, absolutely. And we will definitely stay connected.
Yes.
So some housekeeping items. Thank you so much for watching this, for listening to this. Be sure to subscribe, to leave a review, to like it, to share it with a friend. And if you want to support, you can go to buymeacoffee.com/PH Millennial. Thank you all.